Hi there, this is Barbara Bedney at the JFNA Center for Advancing Holocaust Survivor Care. We are going to get started on our webinar on person-centered trauma-informed program evaluation. Thank you all for joining us. I am in my office here with my colleagues. I've got Amanda Barmash and Amanda Jarvis, and Shelley Warnick is here, and Karen Yoskowitz. Leah Miller is here as well. So it's good to have everybody here. It's good to welcome you all to the call, and thank you for joining us. As you know, at the center here, we are all about innovations in person-centered trauma-informed care and being able to disseminate those innovations to Holocaust survivors and other older adults with a history of trauma. Person-centered trauma-informed care, as you all know, just as a reminder, is a holistic approach to service provision, that promotes the health and well-being of individuals who've experienced trauma by creating safe environments and preventing re-traumatization of those who have experienced trauma in the past. The question that we want to talk about today and what this webinar is about is how we can apply those same principles of person-centered trauma-informed care to service provision. How can we take those same principles and apply them to program evaluation? I think I've probably talked to many of you about program evaluation and why program evaluation is so important and why we do it. Obviously, we want to get feedback from our clients and see if our programs are having their desired outcomes, which is a key reason why we do program evaluation. Program evaluation also gives us the opportunity to say, if we're not having those desired outcomes, what we can do to change our programs so we can, in fact, get those outcomes. So that's a real key reason to do program evaluation. The other reason to do program evaluation, though, it's very person-centered and trauma-informed. If you look at SAMHSA's principles of trauma-informed care, one of those principles is empowerment and voice and choice. That means we need to get our feedback from our clients about the programs that we're doing, about our services, what's working, what's not. It's just a core component of being trauma-informed. But as some of you know, the key challenge there is that at the same time, program evaluation and asking questions also runs the risk of being re-traumatizing. So people who have had experiences where they've been forced to give information that they don't want to, or forced to give personal information, anything like that, going back and now asking them now to answer questions can also at the same time be re-traumatizing. So the challenge for us, and I know I've talked to many of you about this, is how do we design program evaluations that get us the data that we need to show whether we're having our desired outcomes or not, that meet as much rigor as we can in terms of program evaluation strategies and good format and everything like that, and at the same time, make sure we're not re-traumatizing anybody who's filling out those surveys. The last thing, and I know I've said this to many of you on the call, the last thing you want to do is have any evaluation strategy hurt or harm a client or cause any problems with a program and maybe even make clients not come back because they have to participate in an evaluation. So that is the challenge. That is what we're here to talk about today. One of the things we're doing here is developing a tool which we all want to share with you. It's a tool to help agencies develop what we call person-centered trauma-informed program evaluation. I have looked in the literature. I have not seen anything really out there about person-centered and trauma-informed program evaluation. So we are taking the lead on this. This is ours to do, and to see how we can create these kind of tools and create these kind of methods and then disseminate them broadly so that other people can use them as well. So what we're going to do on this call is share a draft of this tool with you. We want to get some feedback and get some ideas with you, what you all think. If it's helpful, are there things that are missing from the tool? Are there things we can add? We want to create something that you can put up in your office and say, okay, we're going to design an evaluation. This is what we need to think through to make sure it's a good evaluation and that we're getting the data that we need and that we're not re-traumatizing anybody that's doing it. So again, what we want to do is show you this tool. I'm going to turn this over to Amanda Barmash in a minute so she can take you through the tool. What we then do is, often the better way to do it is just to show an example. So we'll take you through an example of what one of these might look like. And then we want to get some feedback and some questions from all of you and see what you think about this tool and if it's good and how we might make it even better. So as we're going through this, I would say we have a chat function. I'm not the technology person here, but I understand we have a chat function where you can ask questions. So as we're going through the tool and the example, think about questions, think about feedback, think about comments. Send them all to us. We're going to leave time at the end of the call, hopefully try to get through as many of those as we can. And again, as we go through this toward the end, you can ask questions there as well. So we're trying to make this as interactive as possible. This is, again, ours to do when we can take a real leadership role here in disseminating good practices in terms of person-centered trauma-informed program evaluation. With that, I will turn it over to Amanda, who's going to take us through the tool for a few minutes.
All right, thank you, Barbara, and hello and good afternoon to everybody, and good morning to our colleagues on the West Coast. So here is what the tool looks like. So as you can see, this planning tool encourages you to take a step back and to look at the planning stage for your evaluation strategy with a fresh lens. The purpose of this planning tool is to get everyone thinking about the entire evaluation process, which includes the survey and the questions themselves, of course, but also includes a lot of other factors you might not typically consider. By walking through each question one by one, you'll think about the various components that go into creating a PCTI evaluation strategy. The way we've designed this planning tool is essentially as a PCTI checklist that you and your agency can go through while designing your evaluation strategy. The questions provided in this tool are by no means extensive, and as stated just by earlier, right before, we're hoping to get everyone's feedback on this during the webinar, including feedback on any key questions or considerations we might have missed. Today we'll be focusing only on the survey evaluation method, but we do also have drafted planning tools for other types of evaluation methods as well. So now let's dive into the tool design itself. Across the top row are SAMHSA's 6 principles of trauma-informed care. Under each of those columns is a series of questions you can use to develop survey methods and tools that are person-centered and trauma-informed. Thinking about each of the SAMHSA principles, you want to make sure that your evaluations will take into account everyone's safety, but you also want to ensure trustworthiness and transparency, peer support, collaboration and mutuality, empowerment, and cultural, historical, and gender issues and biases are all taken into account. And these factors, of course, make up these 6 SAMHSA principles of trauma-informed care. The same PCTI focus should be used with every type of evaluation. For example, looking at the safety column, one common thing to consider is where and how to collect completed surveys. If you're asking participants to return these back to a staff member, then that might jeopardize someone's feeling of safety. Providing a closed-lidded box could often work well as maybe providing a drop-off location outside the main meeting space. But then on the flip side, for some populations like Holocaust survivors, they might actually prefer to hand it into someone they know, and that itself could increase their feeling of safety. Continuing on, you also want to make sure that you're getting the feedback you need to best evaluate your program. But if the survey is too long or too short, that can make the participants feel unsafe. Long surveys can also discourage participants from completing the evaluation. Looking at the second column, trustworthiness and transparency, verbal and/or written instructions on how to complete the form are helpful, even if they're brief. It could also be a good idea to provide a brief overview of any scales you might be using, like a standard numbered 1 through 5 scale where 1 is unhappy and 5 is happy, to confirm that all participants have the knowledge to comfortably complete the evaluation. Looking at the third column, peer support, trying to get participants to encourage other peers to complete the evaluation could be done via word of mouth or via verbal reminders by the instructor or staff throughout the program. And please note that, of course, encouragement doesn't mean pressuring participants to complete it. Looking at the fourth column, collaboration and mutuality, as stated by SAMHSA, shared decision-making and partnership is a key component to trauma-informed care. So using a small pilot group or participant advisory committee or some other informal volunteer committee to help discuss and formulate your evaluation strategy and evaluation questions is a great way to ensure this partnership is felt by everybody. Another key component of the empowerment principle is voice and choice. So participants should trust that nothing is required. There's no fear of punishment, and therefore there's no fear of retribution as well if someone chooses to not participate. Making sure everyone knows the survey is optional could be shared by verbally stating this or maybe also writing it on the top of the survey. Looking at the final column, cultural, historical, and gender issues. Using a pilot group or other type of advisory committee, you can gauge participants' comfort level with survey technology. Though it might be easier to analyze the results from an electronic survey, your participants might not feel comfortable using an iPad, tablet, or computer, and therefore you might get fewer participants. Taking into account a factor like this can help you to get as many participants as possible, so you can get as much feedback as possible to improve upon your program. And of course, part of PCTI care is ensuring everyone can feel heard and can feel understood and can understand what is happening. So this includes considering language requirements and avoiding language barriers as possible. Again, a pilot group may help to determine these needs. So now Barbara will walk us through an example of the completed planning tool called the evaluation plan.
And thank you, Amanda. So that is our tool. What we want to do now is take you through an example. Some of these examples will come out of some of my work with you, and some of the examples that I've worked with you in the past. And let's just move this forward a little bit. How do we? Cool. So this example will be from a yoga program. It's just an example, again, to show you how we might do this. The idea, again, is what we want you to be able to do is just, as you're developing your evaluation strategies for each of your programs, you can go through this, you can use it as a checklist, you can fill it out. The idea is to think through each one of these things and how you might implement them in a person-centered, trauma-informed way. So one of the things we do when I talk to you all about your evaluation strategies, one of the things you want to think about in any evaluation strategy is how will you distribute the survey if you're going to do a survey. And again, that's what we're talking about this one. We can develop similar models for interviews and observations and some of these other methods as well. But that issue of how will you distribute the survey, when will you distribute it, will it be around other people? Again, and part of this is knowing the target population that you work with, in this case, Holocaust survivors, sometimes their family members. You all know those better than I do, but the key is thinking about, for the group that you are working with, what is the best evaluation strategy for the distribution of your survey that's going to make it safe, right? And is that going to be around other people? Is that going to be just by themselves? You want to be able to hand it out. Where are they going to return it? In some cases, I've worked with you, again, as Amanda said, that you can leave it in a box in the back of the room. In some cases, Holocaust survivors might prefer to hand it in to somebody they know. But then you want to think about this issue of anonymity versus confidentiality. And that issue gets to, and you always want to think about this when we're talking about surveys, and I know I've asked several of those in the past. If you ask for somebody's name, you want to think about, is that going to, why you might need their name, and ask them for that on the survey. And is that something that's going to make them feel safe? Or is that going to make them feel potentially unsafe or scared or less willing to participate, or in some way even potentially re-traumatize them by having to put their name on something? So it's just one of those things on any survey. You always want to think about that issue of names, and do you need their name, and is it something helpful, and will it or will it not create some sort of re-traumatization? You probably know, just to be clear, if survey isn't anonymous, that means you're not asking for their names on it. If it's confidential, sometimes you're just going to promise to keep it safe. So you really want to think about, again, anytime you do a survey, you're going to think about how you tell your clients that this is safety, that information will not be shared with anybody is going to be really key. And who's going to get that information, and obviously how that information will be used. All get into that first column of thinking about how will you promote the safety of the Holocaust survivors and the clients you're working with as you're thinking about distributing a survey. Talking about trust and transparency, again, in service provision is key. That's talking about how you will make sure that clients understand what services are, how they'll be implemented, all those kind of things. For surveys and for an evaluation, you want to think about what kind of instructions are you going to put on the top of the survey, or verbally and written on the survey, and as you're introducing the survey. Again, in terms of transparency, that's saying, this is how the results will be used to better improve our programs, to create more outreach, to get other people involved. Whatever the purpose of the survey is, you want to be able to share that with the clients who are filling it out. It creates, again, that sense of transparency, that sense of trust. You want to be able to tell them how those results will be shared, and whether you'll go back to them at the end of a month or 3 months and say, this is what we've learned, or you'll go back and you'll put the results in a newsletter, or you'll post it up on a bulletin board or something like that, as you can see here, maybe something like that. Always getting back to them and saying, this is how we're going to do it. It makes people feel like they can trust you. It also gives them that sort of sense of, I know why I'm doing this. and I feel good about doing this because my results will be used and my feedback is going to be important. So I always want to think about that. In terms of peer support, this is always an interesting one because it gets back to all of these issues kind of complement each other and they go at the same time. So you want to, if you can, encourage sometimes Holocaust survivors. If they see other survivors participating in the survey, they might be more likely to do it. But at the same time, you also want to go back and think about their safety. And will they want to feel like you can encourage peers to do it, but at the same time, will that maybe think that they're less anonymous? So you want to be thinking about how participants can encourage other participants to engage in a program evaluation to make them feel safe while they're doing it. You also want to let participants know that if they have any questions or concerns, they should feel free to go to staff and feel comfortable to do that. And again, creating that safe environment where peers can encourage each other to participate in these evaluations, I think can go a long way. I know sometimes I've spoken with some of you and we've seen that client participation in some of these evaluations can be low and people are hesitant to participate. And one of the things I'd like to hear from you all, and I've asked some of you in talks with you, is if you have peers participating in the evaluations, does that help? And how can we promote that in terms of getting more Holocaust survivors to participate? In terms of the collaboration and the mutuality, what we're talking about here is again, you can see here, creating a pilot group. I'm a big fan of piloting surveys before they get out. It can be tricky, it can be time consuming, and figuring out what's the best pilot group to look at a survey. But it creates a much better survey, it creates a much better evaluation strategy. So sometimes we've seen you can get an advisory committee potentially to look at, again, all of these issues really, how you might distribute the survey, how you might ask to get it back, having them look over questions and seeing if the questions are clear enough. Certainly when we've talked about, and I've talked to many of you about this, how do you make questions that are clear and understandable? So if you can get a pilot group to participate and look at those questions and run by them and say, okay, this one is good, this one is clear, this one is not going to get what you're looking for, or again, this one is potentially re-traumatizing. And how to make it more accessible. And the pilot group can also help you to think about those issues and how you can encourage other Holocaust survivors to participate. So I'm a big fan of those, and we can always talk about the best way to do that so that you're creating a pilot group and still getting the best survey response possible that you can get. In terms of the empowerment and voice and choice, that's really, obviously they're all really important, but you want to make sure that Holocaust survivors who participate in these programs understand that they have the option to participate in the evaluation, in the survey that you're asking them to complete out, that they can get out at any time. Obviously, one of the experiences of trauma, I think we've talked about this, is the power differential and the loss of power. So what you never want to create a situation through services or through an evaluation where you're recreating a power differential. So the idea here is helping them understand they don't have to participate if they don't want to, they don't have to answer any questions they don't want to, and giving them that power to choose whether they want to participate and how they want to participate, and that they have the option to not participate if they don't want to. That goes back to adding those instructions as you're giving out your evaluation, to adding those instructions at the beginning, and making it clear that they don't have to participate, why their participation is important, that we need their feedback to understand whether these programs are working and how they're working, and so we can replicate them. But at the same time saying you don't need to participate this, and if you don't want to, and if you feel uncomfortable, you can always talk to us and make that option clear too. And so I think that can help in getting their investment and their buy-in and helping them understand what the evaluation is about. At the same time, not re-traumatizing anybody by creating that power differential. Lastly, we want to talk about the cultural, historical, and gender issues. Some of you have heard me talk about this in the past. I think we need to add age to that category because there are different age groups will fill out these surveys and any sort of evaluation strategies in different ways. But you do want to take these into mind when you're thinking about it. You want to avoid, obviously, as you can see here, you want to avoid potentially triggering language. Obviously, But you also want to take into account language in general. And I know I've spoke to some of you. Some of you are bringing in, having surveys translated, which can be very empowering to Holocaust survivors to see things in their own languages. I know some of you are doing that, so that's a key part of it. Figuring out the mechanism and the medium to which you'll distribute your surveys. Sometimes it's paper. That can be the easiest. In some cases, it's electronically. Obviously, you have to make sure that people have access to electronics, that they know how to use them. Again, that they're not afraid of those kind of things, obviously. So taking all of those issues into account to create a person-centered, trauma-informed strategy. I would add that, and some of you have heard me talk about this before. A couple of years ago, for a different program, I designed an evaluation for older adults. It fit all on one page, and as Amanda said, long surveys can be intimidating and potentially stressful and re-traumatizing. So you want to make sure your survey is a good length. So I had designed a survey that was one page, but that was 11-point font, and I sent it out to a group of service providers, and they immediately stood up en masse and said they would not give it out until it was in 12-point font or 14-point font or higher. So that was a mistake on my end, and that's why you pilot things. And that's why you want it by experts on the field to say, is this working? So what happened then, I had to go back and redesign it into 12-point font. And of course, that made the survey 2 pages. And the group en masse stood up again and said they wouldn't do it at 2 pages. It had to be 1 page. And that is the art and design of survey evaluation and any sort of evaluation method. It's always going back and forth and seeing what's the most effective, what's going to get you the data that you need without overwhelming anybody. So, and what questions you really, really need. And I've worked with some of you on this as well. What questions do you really need and what questions can you take out? So that was what happened there. We eventually did design a survey that was 12-point font and 1 page. So it can be done. And I know I've worked with many of you on designing formatting, so it's appropriate for your age populations that you're working with. We have a couple of more examples here. As you can see, the question is, how many, again, we're talking about how many questions will you put on your survey? You don't want to overwhelm anybody. You still want to get the information that you need. There is, and I've talked to many of you about this issue of open-ended versus closed-ended questions. Closed-ended being checklists and yes and no, agree, disagree. Open-ended giving your clients the chance to write in their answers. And in some cases, some of you I know have told me checklists are easier and they're easier to analyze because you can put them in a database and it's just check marks. Open-ended questions give you more of an opportunity to give clients more of an opportunity to express their thoughts and their feedback, but they can also be intimidating for someone who's not familiar with the language, for someone who has not a lot of background expressing themselves that way. We don't want to make them think that they can't do it or feel bad about not being able to do that. So again, thinking through how many open-ended questions will you ask, how many closed-ended, is there a good combination of both, is a key issue. Can I get some water? Thinking about, again, how the results will be shared. Thinking about if somebody participates in a program or a class or something like that and they're not there when the evaluation is handed out and they still want to participate, how can you get them to participate, encourage their participation, get that survey to them in a different way? Excuse me. Again, offering assistance to anybody who needs it so that they can feel good about completing that survey and participating in that survey. And again, as you can see here, making sure if you do them on paper that it's legible, that it's in a good, clear font, and most importantly, that it's in words they understand, and that will not be re-triggering to anybody. That is the summary of the tool. We are just in the beginnings of this and seeing what's going to work and what we can make effective. What I want to do now is take a drink of water. Is sort of see if anybody has some ideas or feedback or what we can do to make this better, stronger, easier for you guys to use, and just get some feedback from there. So how do we do that? What do we do now? And Amanda is going to show us how to use that chat function, or tell us about the chat function, so we can sort of get your questions and thoughts and see what you think.
So there's the chat function you can see so you will be able to type in questions there or any feedback you have. We're trying to get to it right now. Thank you. So feel free to type in anything.
So we have a question. Can you show us the actual survey form? So we have, you know, what's an interesting point? We have not, and there you go, something we can think about right away. So I have worked with many of you to think about how to design surveys using these principles. We do not have, boy, that's a really good question. We do not have an example of a survey that we have developed based on these strategies, but I think that is an outstanding idea, and maybe one of the things we could do as we think through this and be able to get this out to you guys is think about an example of a survey tool and a method that would incorporate all of these principles. So I think that's actually an outstanding idea. Thank you. And we have a comment, the checklist looks thorough and user-friendly. That's good to know. Again, this is based on comments and feedback from all of you, so that is good to hear. Again, it might not be as complete or as thorough as we can, so if anybody has anything we can add to it, I think that would be great, but we did try to make it as complete based on some of the literature about program evaluation and some of my comments and feedback and working with you guys. So that is good to hear. What kind of open questions for the after activity survey would you recommend? I like these questions. I could do this all day. So in terms of open-ended question, anytime you ask a question, you want to think about the goals that you're trying to achieve with the program and the goals that you're trying to achieve with the survey. So anytime you ask an open-ended question, it can be used as a follow-up. So if you say agree, disagree, and you can add a follow-up question there that says, please explain your answer, in which case the open-ended question is being used to clarify an answer that somebody has already given and give them the opportunity to add more information to their answer. In some cases, the open-ended question can be more open and just say, please tell us what you think about this, or please add any comments or suggestions. That is more open, and that gives clients, Holocaust survivors, whoever it is you're working with, the opportunity to provide feedback in any sort of way and to generate some ideas that you might not have thought of. So the beauty, excuse me, of open-ended questions is you're going to get data potentially that you hadn't thought of that you can use for evaluation, and also use it to potentially create a closed-ended question the next time you do your evaluation and add it to a checklist. The thing about open-ended questions, again, is people might not feel comfortable with it, and you always, when it comes to open-ended questions, is you want to think about how you're going to analyze that data. Because with open-ended questions, you could get a whole lot of data, and you want to think about, will you go back and analyze that data and code it, or will you just use it as quotes? But it's a great question and something to think about in terms of the Holocaust survivors and the clients that you're working with. Which do they prefer? And in some cases, you know, it might be closed-ended, and in some cases, I know I've talked to you that they prefer the open-ended questions as well, which has actually come as a surprise to me. I would have thought the closed-ended would be a little bit easier, but again, it's knowing your client population and who you're working with and what they would prefer. It's a great question. Thank you. I'm going to go up. It looks like we have some more here. Oh my. Any thoughts on successes of evaluation related to the time of year? Another great question. How often, and we need to put this on the grid actually. The question is how often, and that is just a great question, How often will you do the surveys? And I know I've talked to many of you about this as well. You certainly, from an evaluation point of view and from a trauma-informed point of view, you don't want to overwhelm anybody with doing surveys too often. Sometimes I've even seen if you survey people too often, they're hesitant to come back because they know they're going to have to fill out a survey. And that is the last thing anybody would want. The first and foremost rule of program evaluation is it should never interfere with services. And that's the first thing you want to make sure it never does. So it's a question of, and thinking about is how you would use data. Do you need to get the data once a month? Probably not, unless it's going to help you determine initially as you're starting a program, is the program at the right time, in the right place? Are we attracting the right people who we want to get there? You want to think about, as you're thinking about when to do an evaluation, and this is really important, they're all really important, but when might you see the desired outcome, right? So I know I've worked with many of you about the issue of social isolation and programs targeting social isolation. It can take a little bit of time to see if you're having that impact. So you may not want to ask that right away. You may want to wait 3 months, 6 months down the road. So as you're developing your evaluation strategy, you're thinking about, when am I likely to see that outcome? You don't want to ask too soon and then say, well, it didn't happen, so the program is not working. That's the art and craft of program evaluation, is thinking about when you might expect to see that outcome and then asking at that point. On the other hand, you also want to think you can start a program evaluation right away to sort of get your process outcomes and start thinking about those preliminary things like, did people show up? And did they like the speaker? And was the time good? And all those things that will help you determine, should we do this again in the same place and time? Should we change something about it? So those process sort of indicators you can start looking at right away. You can do them initially. You can wait, a couple of months down the road and do them again. The idea with doing those more frequently is you want to be able to have the power to change your programs. So you don't want to wait 6 months to find out if the hour is not right and you want to do it at a different time. So you always want to think about that combination of what can I do now without overwhelming anybody with data and questions, but that will give me the power to be able to change a program if it's not working exactly the way I want it to. It's great. These are all great questions. What do we got here? We have a drawback for open-ended questions, and yes, there are many. Too much detail, and to what purpose? What was said was enough are the usual responses. So open-ended questions, people will often leave blank, or they'll just put in one sentence, it was great, I answered this, or something like that. The problem with that is, and again, this goes to the comment about some of the drawbacks of open-ended questions. The people who provide comments often tend to be a little bit more biased than those who don't. So you always want to take that with a grain of salt. Sometimes the answers that you get to an open-ended question, research would tell us that they tend to be those who really liked it or really didn't like it. And others will tend not to just fill it in. So you always want to think about that in terms of making sure you're getting an unbiased view of the data that you get. And again, when we start talking about being trauma-informed, you want to make sure that those open-ended questions are accessible and understandable to anybody who has a traumatic background, and that they feel comfortable and safe providing those open-ended answers to those kind of questions. Really, really good point there. Going down. We might not get to all of these, but we'll do the best that we can. What are some of the outcomes that we should be thinking about for survivors? That would affect the type of surveys that are developed. It's a really important point. The outcomes that you should be thinking about for survivors are exactly what the surveys and any sort of evaluation methodology should be based on. The survey is based on what you want the outcomes of the programs to be. So as you're thinking about, and I promised everybody I wouldn't mention logic models, but I'm about to break that promise, so my apologies. You want to think about a logic model for your program, because as you're thinking about what the goals of the program are, you want to think about at the same time how you're going to evaluate it. So if you decide the long-term goal of this program is to decrease social isolation, immediately you know that's the outcome. Those are the questions you need to ask in a survey, is did we decrease social isolation? Now again, you might not want to ask it that way. And that gets to that issue of language and being trauma-informed. You want to ask that question in a way that might not be re-traumatizing. So I've worked with some of you to look at what are potential indicators of a decrease in social isolation. Do they go out more? Do they know more people? Do they feel more connected to the community? Those kind of things which are a little bit easy to understand. They're more concrete rather than the issue of just saying social isolation. The idea is the same, and that gets to the question here. You're always thinking about, as you're designing your evaluation strategy, whether it's surveys or interviews, whatever it is, you're always thinking about what the goal of the program is and how am I going to evaluate that. And that's what you always base your surveys on and your questions on, okay? It's a great question. Thank you. What do we got here? We choose to have, this is, yeah, okay. So the question is, and it's a really important question, as are they all. And I don't have the answers to all of these. Some of them are worthy of really thinking through, and which is going to be, which approach is going to get you the data that you need to help the program, and which, again, is going to be not re-traumatizing and, again, promote that safe environment for your clients. So the question on the table is, who should administer staff? Who should administer surveys? Should it be the program staff? Should it be somebody else? And what's the best way to go with that? So again, you can't really do an anonymous survey if you're handing it back, if a Holocaust survivor is handing it back to staff. A Holocaust survivor, any client, family member, any client that you're working with, might feel uncomfortable or pressured to say something in a certain way if they know it's going back directly to staff. So that could create an issue right there in terms of somebody feeling bad about that and not wanting to do it, or not wanting to participate at all, or you're getting biased answers and somebody is saying something because they know they're turning it into the program staff. On the other hand, I have heard from some of you that some of your survivor clients want to do that and they feel less comfortable turning it into somebody they don't know, because that potentially creates an unsafe environment because they don't know who that is and they don't know who, what's going to happen to that survey once it's given in. So both something to think about. I'm not a big fan of having clients turn surveys into people that they are working with. I think it creates biases. But we also want to figure out a way that again, makes it safe. So they, again, maybe creating a Dropbox in the back where they can turn it in anonymously or just leave it behind when they leave or something like that. There's a couple of different approaches to think about that, again, makes them feel safe. And again, I'm a big fan of safety is everything when it comes to person-centered trauma-informed care. And clients and Holocaust survivors need to feel safe in returning these things. And whatever is going to create that safe environment, I think is going to be a good thing. And thinking about the strategies. And again, is it on a phone call? Is it having them turned in afterwards? And what's going to be, again, make a safe environment for them, at the same time get you some good data that you can use to be able to show that you're having the desired outcomes, or that you can change something to have those desired outcomes. What do you think about adding in observations from staff and caregivers? So Amanda mentioned we are going to design, if you all think it would be helpful, another one of these tables for observations. Observations create a whole number of different challenges in terms of confidentiality, and people know that they're being watched, and do you tell them or do you not tell them, and if you tell them, is it going to change their behavior, and all of those things. So that involves a whole nother table that we're going to have to get to at another time. A note just in terms of caregivers. I have seen something in the past where with programs, I don't know if anybody's doing it here, for programs for older adults who have Alzheimer's or dementia, and they will ask caregivers if the program is helping, sometimes ask caregivers for observations. I think it can be a valuable tool as long as it's done well. The question there is, and something to think about, boy, we could go on for this for days, is who's the client there? right? Who are we empowering and who are we giving voice to? Because you always want to give as much voice and empowerment and choice as you can to the individual who has Alzheimer's in this case potentially, as well as to their family caregiver. And make sure as much as we can that both voices are heard. I will tell you, I have not seen as much as I would think I would see at this point in terms of evaluating programs for individuals with dementia based on their observation and feedback. But if we look back at trauma-informed care and this idea of empowerment and voice, I think we need to figure out a way to do that as a field and get their perspective and their understanding of how the programs are helping them, at the same time potentially having an impact on their family caregiver. And I think if you can positively influence an individual with Alzheimer's or dementia, you're going to positively influence their family caregiver. So it's a great question, and I think the field as a whole is still grappling with some of those issues in terms of getting feedback from the caregivers and observing the caregivers as well. We have if the staff, yes. So the question, again, this goes back to, and it's a great point, thank you, in terms of trust. And trust is on this column too. And Holocaust survivors need to trust you guys in order to be able to both participate in the programs and participate in the evaluation. So trust and safety go together as far as I'm concerned. So having staff, again, distribute the survey maybe and explaining what the survey is a component of that trust. Maybe even explaining that they're not going to be the one for reasons, because you want to say to survivor, we want your honest feedback. So I'm staff here, I'm giving this to you, I know I work with you, I'm going to have somebody else get it from you and do it that way so that you can, so that they can feel honest and give their honest answers if they want to. It's a good, you want to avoid the biases, you want to avoid somebody feeling that they can't give the positive information or negative if they want to give negative feedback. But you also want to make that environment in general feel like it's a trusting environment and they know who they're giving that form back to if that's what they want. So it's thinking through that strategy and which is going to get you the best unbiased data, again, without re-traumatizing your clients. And it's always going to go back to that. And I know everybody on this phone is always aware of that. And what we want to do here is figure out some of the strategies that can meet that challenge. And that challenge is creating person-centered trauma-informed program evaluation without re-traumatizing anybody. I think one of the things we can do maybe with this tool is think about, maybe we can get some strategies about how all of you are using it and start to share some of those strategies broadly. So how do you do that? How do you deal with that issue of staff? And do staff, is it good to have staff distribute these things and return them or not, or put them in a box? I think if we start collecting some of those strategies that are working, I think more power to us, and we'll have an enormous contribution to make to the field. So I'd love to hear from some of you about how these are working and or not. And some of the strategies you're developing based on this tool. What are some of the effective ways in which data can be calculated, turning the answers into numbers which can be measured? Spreadsheets. Spreadsheets are good. You always want to think about, again, how you're going to, and I know I've probably said this before, anytime you're designing an evaluation strategy, whether it's surveys, interviews, observations, the first thing you want to think about is what the goal of the program is, and then design the evaluation based on that. The other thing you want to think about almost immediately, and all of this happens at the same time, is how are we going to analyze the data that we're going to get, right? Always want to think about that. And you want to make sure you have the capacity to analyze the data before you collect any data. And I'm almost certain I've said this before. You never, ever want to collect data that you don't know how you're going to use, right? And how you're going to analyze and how it's going to help you understand your programs. That is right up there on the top of the list of things you want to do. So again, going back to that issue of open-ended questions, if you don't have the capacity to really think through how you're going to understand and analyze that data, that may not be a good way to go to collect a whole lot of those. Maybe you just do one instead of 5 of those. Always want to think about how you're going to analyze that data. I know some folks have done spreadsheets. You want to think about how you're going to report back the data. Is it 65% of people agreed with this, 35% agreed with that? That kind of data can be very powerful in showing the impact that you're having. There's other ways to look at data, and I know I've gone over with many of you to think about how you're going to analyze that data so we make sure when you start collecting that data, you have a good plan for analyzing it. And that includes everything from where you're going to store it. Are you going to create a database? Again, going back to those issues of anonymity and confidentiality, what that database is going to look like, what calculations you maybe want to do with that database. So it's a great question and something to always think about how we're going to get that, how we're going to analyze that data that we get. Because with open-ended questions versus closed-ended questions, obviously you're talking about a different data analysis. What has the typical survey response been from Holocaust survivors, and what percentage do we consider to be reasonable? So it's a great question. I know in some cases it has been difficult for some programs to get Holocaust survivors to participate, so we'll try going back, and I know I've worked with some of you to say, okay, let's go back and see if we can add instructions on the top of the survey. Or let's see if maybe we can take out this question because it's a little bit not clear and it's not something we want to get to anyway. I have seen some surveys from you all, some survey responses where you've got upwards of 90% of survivors to participate in them. I've seen some that are lower, and what we want to do is figure out, for some that are lower, what is, and I know I've talked to some of you about this, if the response rate is not what you want, how can we go back and make that response rate even stronger? And again, we want to look at, is it the survey? Is it the timing of the survey? Are there other things going on that Holocaust survivors are not wanting to participate? So we want to get as many to participate as we can. I don't necessarily have a criteria, but I will say the more respondents, the more clients that participate, obviously the more powerful the results are, and the more we get to say, yeah, we know this program was successful because 50 participated and 50 Holocaust survivors completed the survey, or 45 completed the survey. It adds more power to what you're able to say about your programs. It adds more power to what we're able to say about the programs and their success. So obviously we want to get that number to be as high as possible within the context. Again, everything goes back to that person-centered, trauma-informed. We can't force anybody to do it. We can't force anybody to not answer any questions that they don't want to. And that is our challenge, and that is a challenge that I think other evaluators are not facing as much as we are in keeping that not re-traumatizing anybody in focus. So again, I don't know if I have a typical one, but I would say the more we can get Holocaust survivors to participate in these things, the better. And if we see that they're not participating, we can always go back. And I know I've done this, always go back and say, okay, what do we think the issue is? An advisory group, again, a pilot group can always be helpful with that. If you can go back to an advisory group of Holocaust survivors and say, look, our group's not participating in this. What do we think the issue is? How can we go back and make these a little better and stronger so people will want to participate? And we're dealing with a population that may not just want to fill these things out because of their histories and their background and everything else. So we can do the best we can to encourage them to participate. And I know some communities have done that really well. I'm going to keep going until my voice falls out. You want to come in and read the questions? And we'll keep going as long as we can here. Press the call button. I think we might. We're going to catch up with you. We'll be right there. Okay, we got. I think we're over here. Can you use this kind of method as a baseline as well as collecting more subsequent data points? Potentially, I will have to follow up with you, I think, and just get some more clarification on that. Again, this table is designed to be used as a tool to create surveys. But if there's a way to use it as a baseline, again, what we might want to do, and I know we're talking about it here, is developing a survey, an example of a survey based on on these principles and based on the table. I don't know how we would use it as a baseline, but I'm interested in seeing what other people say, and maybe we can follow up with you about that. We got here. Yeah, we're going to go over here.
Just one comment. There's one comment here that says, we provide music programs for older adults with dementia. We're utilizing a mood scale, a Likert scale from 1 to 5, and we administer the survey to the participants with dementia and also the caregiver.
So it's an interesting thing, which we haven't actually talked about yet at all, is an issue that just made me think about this in terms of standardized scales and tests, and there are some that I think some are using, the quality of life indicator, those type of things, Beck depression scales. I know I've talked to some of you about that, and some of those can be really valuable. They can be tricky. Sometimes you need permission to use them, and a lot of times they don't always get to the goals that you're looking for. And you know what? It's just, as we're talking, I think it's a great point. I don't know that some of those, I would fairly guess none of those, were developed with a person-centered and trauma-informed point of view. So I don't know if some of those scales maybe possibly could be re-traumatizing, but it's something we'd want to take a look at. I know they're very good scales, they're all validated, they have some good research behind them, but again, some of the wording, I'm not sure whether that would be difficult for a survivor or their caregiver. I know there are some specific scales meant specifically for caregivers, which is great when you're talking about family caregivers of individuals with dementia. That burden can be extraordinary, and I would say when you start talking about family caregivers of individuals with dementia who also are Holocaust survivors and dealing with lengthy histories of trauma, that is an extraordinarily difficult situation. So anything that can measure whether a caregiver is doing better as a result of those caregiver support programs would be a very good thing. It's interesting. We developed this tool thinking about person-centered trauma-informed care, mostly for Holocaust survivors. I wonder, and maybe we can get some feedback from you all at some point, if it would be different criteria for a family member, if there would be different things we'd be looking for to create a person-centered trauma-informed survey or interview or observation for a family member. I don't know. It's something we're going to have to think about here a little bit more as well, but it's a great point. I think we might do it all. If anybody else, I think we're done. See if we have any more. If anybody has anything else they want to add, you can let us know. If not, I think we're going to just about end there. I'm going to bring Amanda back in, who will tell us a little bit more about the follow-up from the survey and where we want to go from here. I want to say thank you to everybody on this call, to all of you, for all the work that you are doing. It is extraordinary. Part of my role, part of what I get to do is to document the good work that you're all doing, and it is an honor and a privilege to do that. This tool is something that is bubbling up from my work with all of you. This doesn't exist yet, so we are taking a lead role in developing these kind of strategies and taking program evaluation to the next level. And when you think about the number of older adults out there who have experienced trauma, this is extremely important work, and I am proud and honored to be working with all of you on it. And with that, I will turn it over to Amanda, who will wrap this up for us.
All right. Well, thank you to everyone for joining us with the great feedback, and thanks for discussing PCTI evaluation strategies with us. So moving forward, the hope is to take a lot of the feedback we've received today, and we hope to continue to get feedback from everyone as well on this tool, continue to improve it, and then set it out to you guys to be able to use as a sort of toolkit to create your own PCTI evaluation strategy, using with the example and with a slight instruction sheet as well. So the next steps are that we will soon send out the follow-up email with a link to the recording, a copy of the PowerPoint slides, and also links for both the attendance verification form and the webinar evaluation form. For those of you who are in our Charlie and Delta cohorts, the attendance secret verification word is evaluation. So please enter this into the attendance verification form included in that follow-up email to confirm that someone from your agency has viewed this webinar. For all participants, please complete the brief 6-question evaluation survey, also included in that follow-up email, because that helps us to improve future webinars. It helps to get feedback on today's webinar, and also to share content ideas you might have for future upcoming webinars too. We take this feedback very seriously, and prior feedback has really helped to shape our webinars moving forward. So again, thank you everyone for participating in today's webinar, and have a great day.